My name's Rachel Wilkins. I'm a first-year medical student at Oklahoma State College of Osteopathic Medicine at the Cherokee Nation campus. Today, I will be presenting asthma callback survey results, a need for increase of asthma action plans, and allowance to carry medications. Below, I have also listed my contributing authors. More than one-third of everyone diagnosed with asthma is a child. With 7.1 million children in the United States currently diagnosed, asthma is the most common childhood chronic disease. Out of all these chronic diseases, asthma is one of the leading causes of absences in schools. Students with access to considerable healthcare resources at their school may not have an increase in amount of absences compared to those students who do not have asthma. These resources include an asthma action plan, continuing education resources, and school nurses. Quality treatment of complex conditions such as asthma requires appropriate patient screening and education. Long-term goals of asthma management include achieving symptom control, maintaining a normal activity level, and minimizing risk of asthma-related mortality, exacerbations, persistent airflow, and side effects of treatment. Our research question and our objective was to analyze the amount of children with asthma permitted to carry medications in school and to assess the prevalence of children with an asthma action plan in school. For our methods, we used the CDC's 2017 and 2018 Behavioral Risk Factor Surveillance System Asthma Callback Survey for Children, also abbreviated as BRFAS. We assessed the prevalence of children in school that were allowed to carry medication and if they had an asthma action plan. We assessed if there was a difference in allowance of asthma medication in schools or having asthma plans based on urbanicity. We included only children who were in school and who reported to currently have asthma, ranging from age 0 to 17 in BRFAS defined age groups as shown below in Figure 2. As you can see, BRFAS divides the kids into 4 age groups: 0 to 4, 5 to 9, 10 to 14, and 15 to 17. Our results are pictured below. On the left top is asthma medications allowed in school. Nearly 35% of students reported that they were not allowed to carry asthma medications. The picture on the right is written asthma action plans in school. 58% of the students were not able to have a written asthma action plan. Below is the data divided by BRFAS age groups. Nearly 51% of children aged 5 to 9 and 33% of children ages 10 to 14 were unable to carry asthma medications at school. Reported urbanicity was not significantly associated with either medication access at school or having an asthma action plan. Improving asthma control status positively affects school absenteeism, academic success, and quality of life. These factors are further elevated with increased levels of asthma control, school environmental conditions, and teachers' knowledge of students' conditions. Establishing relationships between school, healthcare, students, and physicians is essential for effective asthma management plan implementation, especially in the educational setting. Asthma action plans require albuterol to be available in order to be effective. Additionally, implementing protocols for stock albuterol to be carried in schools increase access for medication for children who are not permitted to carry it or not old enough to know how to use the medicine they carry on their own. This is particularly important in Oklahoma due to the fact that our state, the amount of children with uncontrolled asthma is 10% above the national average. In conclusion, more than one-third of students were not permitted to carry asthma medication, and nearly 3 out of 5 did not have a written asthma action plan. These findings reflect the need for Oklahoma, along with many other states, to improve access to medication. In addition to written action plans, to improve asthma medication in school. Below, I have listed my contact information as well as the second and third author's contact information. If you have any questions, please feel free to reach out with me, or I can answer them in person at Research Day. Thank you.